Welcome to Best Home Remedies. Today, we will talk about the 10 signs of high blood sugar that you really shouldn't ignore. It's actually entirely possible for signs of high blood sugar to fly under the radar. There are a lot of people who don't realize they have high blood sugar, so if this is the case for you, you certainly aren't alone. As of 2020, more than 34 million people in the US are living with diabetes and more than 422 million in the entire world. This condition occurs when your blood sugar is too high, either as a result of insulin resistance in the case of type 2 diabetes, or as a result of your pancreas not making any or enough insulin in the case of type 1 diabetes, according to the Center for Disease Control and Prevention (CDC). However, 21% of adults with diabetes are unaware they have the disease, according to the CDC. In addition to that, there are about 88 million US people, or more than 1 in 3 adults, who have prediabetes, which occurs when blood sugar is higher than normal but not high enough to be called diabetes, and only 15% of adults with the condition reported that a health professional had diagnosed them with the illness, the CDC says. Given this situation, it is vital to know the signs of high blood sugar and to seek medical care if you experience them, along with getting tested if you are asymptomatic but have risk factors. With that in mind, here are the signs of high blood sugar you should be aware of. 1. Fatigue. Feeling tired may be the most common early sign of high blood sugar. It's also one that can occur, to a mild degree, with even the mild and normal blood sugar fluctuations that happen in people without diabetes or with prediabetes when they consume a large amount of simple carbs, like sugar, she says. Of course, tiredness is a pretty nonspecific symptom. If you notice fatigue regularly occurring right after you eat, though, especially a carb-heavy meal, it may have to do with rising blood sugar levels. To be clear, there's nothing wrong with eating these foods. But if you notice that they always affect you in a very specific way that you find troubling, like always making you incredibly sleepy, it's a sign you may want to talk to a medical professional. 2. Frequent urination. When you have too much sugar in your blood, your kidneys start trying to pour out more sugar to get rid of it. And as they excrete the sugar, they pull out water with it. This makes you have to visit the bathroom more than usual. 3. Increased thirst. This is a natural effect of peeing more, because your body becomes dehydrated. People start feeling thirsty all the time. The dehydration also becomes cyclical. The more you pee, the thirstier you are, the more you drink, the more you pee, and so on. 4. Headaches. Dehydration from any cause can trigger headaches. Of course, headaches can be a sign of many different things, but it's worth getting checked out if it's something new or coupled with other symptoms here. The dehydration can also worsen your fatigue in addition to your headaches. 5. Blurred vision. When there is excess sugar in the blood, it can affect some unexpected areas in the body, like your eyes. Essentially, extra sugar along with a little water gets trapped in the lens in the middle of the eye, causing a blurred effect. This is temporary and not the same as the damage to the eye that can occur in the long term with a condition like diabetes. 6. Nausea, vomiting, and confusion. These seemingly disparate symptoms are all signs of a rare and life-threatening state called diabetic ketoacidosis (DKA), according to the U.S. National Library of Medicine. DKA can cause the symptoms above, as well as stomach pain, trouble breathing, dry or flushed skin, fruity-smelling breath, or difficulty paying attention. It usually occurs in people with type 1 diabetes and is sometimes the first sign they are sick, according to the U.S. National Library of Medicine. DKA happens when the liver is unable to use the sugar in the blood for energy without insulin and begins to break down body fat into a type of fuel called ketones at such a high rate that they become toxic and make the blood acidic, the U.S. National Library of Medicine explains. DKA can be fatal if left untreated, so anyone experiencing these symptoms should seek care immediately. Over time, untreated high blood sugar can cause additional symptoms, such as 7. Recurrent infections. Consistent high blood sugar can weaken the body's immune response, according to the CDC. This makes it harder for your body to fight off some infections, making them more frequent, lingering, or serious. 8. Slow healing sores. High blood sugar levels can affect your body's circulatory system as well, impairing blood flow and the body's ability to heal itself. Sores that take a while to heal, often on the feet, are a common sign of this decreased circulation. 9. Dental issues. Glucose is present in your saliva as well as your blood. When there's too much of it, it helps harmful bacteria in your mouth grow and combine with food particles to create plaque. This leads to issues like tooth decay, cavities, gingivitis, gum disease, and bad breath. Swollen, tender, and bleeding gums are one of the first things to look out for. 10. Tingling hands and feet. Over the years, high blood sugar can begin to impact nerve function and eventually cause nerve damage, called neuropathy. The most common kind of neuropathy is peripheral, which affects the extremities. You might start noticing feelings of tingling, numbness, or burning in your hands, feet, arms, and legs. These are the 10 most common signs to indicate high blood sugar. Hope you enjoyed the video and don't forget to subscribe to our channel.